Direct them to the places in greatest need.
We are directing states, and sometimes we'll be competing against states, which I don't want, and we'll drop out of the bidding. We want the states to go first. And you know, what we're doing is we're helping states. That's what we want to do. Same thing with the testing. We're helping states. We're helping states get to where they want. And we've made tremendous progress in every aspect of it.
This happens for
It's happening
government needs
fast now.
equipment today.
Well, it's happening fast right now, and the governors are out there trying to get, and if they are competing with us, we immediately drop out, please.
Mr. President, forgive me if I heard you wrong at the beginning. You said something, we are going to be going over to the Hill. Are you going yourself?
My people are, and I'll be staying here. I'll be in the Oval Office and various other places in the White
And
House.
on that matter, you're asking Congress to essentially pass a series of legislation that's going to amount to about $2 trillion, 10% of the GDP. What do you say to members in both parties who say this is too expensive, this is just too much to debate and get done in 48 hours or so? And also, have you spoken directly with Speaker Pelosi at all about any of this?
Okay, so I've spoken with, I'm not going to say who I speak with, but I've spoken with directly or indirectly everybody many, many times. We're doing very well. I think the Democrats and the Republicans are going to come up with a package that's going to be really something very special. It's going to help people. This is the first time there's ever been a case where you want people not to work. It's always, you want to create incentive to work. We're creating not an incentive not to work, but the fact is we're asking people not to work because of, we have to stay away from each other. If we're going to kill this horrible hidden enemy, we have to stay away. So there's never been a thing like this in the history of the world, and other nations are doing similar things, some effectively, some not effectively. They're doing similar things. We are creating a package that's going to keep companies together, keep workers paid so they can live and sustain. We'll see what the timing is. The biggest thing we can do is get rid of the problem. The problem is exactly what we know, the medical problem. We want to have this whole incredible situation that it can start right away. Not that all these companies break up, all the workers are out of jobs, you can't put them back together, and it would take years to put them back together. Because we had the greatest economy in the history of the world until we got hit by this problem. And we can be back very, very quickly. And it's our intention to be back very, very quickly. So we're doing a package, the likes of which nobody's ever done before. I'm obviously the one that has to approve the different things and the recommendations of the different things. And like buybacks as an example, and stock buybacks. I didn't like it the first time, and this time I'm saying, you're not doing it. I don't want money to be used for that. I want money to be used for workers and for opening businesses, keeping businesses, not buybacks. And well, I am strongly recommending a buyback exclusion. You cannot buy back your stock. You can't take $1 billion of the money and just buy back your stock and increase the value. Please.
On the subject of masks, the Vice President announced HHS was ordering hundreds of millions of them. Was that order just placed today? How is that going to be distributed, and when can doctors and nurses expect to actually receive those masks?
Yeah, HHS is completing a $500 million order of N95 masks, and all of this is being coordinated through FEMA, and we are responding specifically to state requests where the needs arrive. As Dr. Fauci said, we want to make sure that people that are providing healthcare services to people who may have contracted coronavirus have the protection to keep themselves and their families healthy. But I want to emphasize the supply of so-called N95 masks has been vastly increased in the country because the president insisted that we extend liability protection to industrial masks. What all the experts told us early on was that industrial masks that are used on construction sites, the president's very familiar with from his past life, are perfectly appropriate to protect healthcare workers from respiratory illness. But they didn't have the liability protection because they weren't created for hospitals. We worked with leaders in both parties. We added that protection that runs through 2024, that now the industrial N95 masks can be purchased by hospitals, purchased by states, purchased by HHS, and distributed through our system. So we're making those available. The supply has been, as I said, vastly increased, and it was another step forward in a bipartisan accomplishment. And we're continuing to use all the kind of creative means of American industry to make sure that we're leaning into this effort and that we do whatever it takes to make sure that our healthcare providers have the protective
We are
equipment.
still
they
hearing
need.
from doctors and nurses about this shortage. When exactly can they expect to receive these masks, though?
Well, let me let Pete Gaynor speak to that, because FEMA will be, HHS is now fully integrated into FEMA. And so as the requests come in, but obviously, as I'm sure the administrator will say, they're being prioritized to those areas with the highest need.
So within the National Coordination Center, we have a supply chain task force. And in basic sense, we're trying to identify the universe of what's out there. So whether we hold it at the federal level, we hold it in the private sector, and then match that up with demand and asking people to be creative. We're asking, again, this is a shared responsibility. We're asking locals and states to do your share locally, try to take a little bit of burden off of us, and then we'll prioritize those scarce resources, because every single governor across the country is looking for the exact same thing. So there's a balance, but we're examining the entire supply chain to make sure that
When
we
will
make
the
them.
masks start coming in?
They're out there now. So again, we want to match. We want to get out of the middle, I think. So we're trying to match suppliers with demand. So that's what we're doing right now. It's happening today.
They can expect them today, or the matching supply and demand?
There's a range of requests across the country, and we're trying to match those again, supply and demand every day. Through the task force.
We have a lot have already come in. I have to tell you, the throwing away of the mask, being in private business, the throwing away of the mask right away, they're thrown away, and when you hear 55 million masks, or what I'm saying, 55 million, how could it possibly be such a number? And they say, oh, that's just a small fraction of what we need. And I said, why aren't we sanitizing masks? You know, you look at the masks, I've looked at all the different masks. Some don't lend themselves to doing that, I think, but many do. And I said, why aren't we have very good liquids for doing this, sanitizing the masks. And that's something they're starting to do more and more, is sanitizing the masks. And I don't know if anybody would like to speak to that. You might want to.
Yeah, there are CDC guidances about how you can minimize the use of masks by different things that you could do with testing, and when you have masks, how you might reuse them, which ones you can reuse them.
Do you think there's a solution to this other than buying more masks? Do healthcare providers need to change how they're using them?
Yeah, well, there are a couple of things. One, for example, we are moving towards getting testing where you don't have to have PPE. I mean, I'm not going to tell you the day it's going to be there, but it's going to be a swab that you can stick in the nose of the person who is either infected or not, but that person doesn't need PPE, the person who's administering the test. So if you could do a self-administered test, stick it in a vial, hand it over. You don't need a mask, you don't need PPE. That's one of the things we're trying to do.
I would have liked